Febrile illness is the most common one that you get in blood transfusion. Is a type 2 anaphylactic reaction, and it's not allergic, but it's type 2 because it is due to antibody and antigen reaction, but mostly for the leukocyte on the individual blood. So sometimes if you immunocompromise, you get leukocyte reduced so that you don't have fever reaction. The way to manage them is to stop the transfusion, notify the doctor, and give them some Tylenol. So the febrile illness is a type 2. So we go down the list and then we'll answer the question. So type 1 is usually associated with the IgE, okay, IgE, that is immune-mediated allergy reaction, basically, and is due to histamine release from mast cell. And therefore, you expect that to be common with allergic reaction, okay, and anaphylactic reaction. Type 2, I told you, is antibody-antigen reaction. If you occur with the individual leukocytes, is a febrile. If you occur with the antigen antibody on the blood cell itself, it's acute hemolytic. So these two are together, and these two are together. Okay. Attack to the donor leukocyte. I told you the white cells being attacked is due to the febrile illness. And in fever, you can figure it out because this is usually involved febrile and hemolytic. There's type 2 hypersensitivity, and with attack to the leukocyte, yeah, this will have fever. Okay, and then the acute hemolytic people, they can also have some fever. Hives and urticaria, yes, you expect that because it involve IgE response, which is allergic response, and anaphylactic. Anaphylactic is the severe form of allergic response. Bronchospasm, yes. So bronchospasm is very, very important. Like I said, anaphylaxis is usually severe form of allergy, and you don't get in the febrile non-hemolytic or hemolytic. You don't get it in allergy. If you see allergic reaction from blood transfusion with bronchospasm, we call it anaphylactic reaction. Deficiency in IgA. This is very, very common in anaphylactic. Most people who have anaphylactic reaction from blood transfusion, they have deficiency in IgA. Therefore, you have to make sure you check the patient. You do all this lab work before you do the trans. That's what they do with cross-matching and other things. So that's anaphylactic. Dyspnea. That means you get to the point that you're having airway issue. And you can think like it does not occur with febrile, no acute hemolytic or allergies, mostly anaphylactic. You have anaphylactic reaction. Tachycardia can be broad. Okay, tachycardia, patient when you're febrile, your heart rate can go up. Okay, it's common, it will happen. Acute hemolytic anemia, you may have a little bit of tachycardia because of the anxiety. Allergic reaction is also possible. So you can see them, it's non-specific for all of them. It's more common with the anaphylactic, but you can see in all of them. Back and chest pain, you can think about it. You should not see that in an anaphylactic reaction. You should not see it in allergic. You should see it in hemolytic. This is classic for hemolytic. They have hemolytic reaction. The cells are being destroyed by the antigen antibody reaction. If the cells are being destroyed by antigen antibody reaction, you release your hemoglobin into the system, and the patient can become jaundice, or they will have hemoglobinuria. So this is common with acute hemolytic reaction. And in itchiness, pruritus, what do you think? More common, that means you're having some allergy reaction to the blood. So this is very common with that. Like you say, anaphylactic is severe form of allergy, and an acute hemolytic is severe form of febrile illness. But you have to be able to distinguish between them when you see them. How do they look like? Key features for each of them. What are the key features for febrile non-hemolytic? Is non-specific, like tachycardia. They may have fever. That's the classic for them. And they have headache, flushing, chest pain, which is a type 2. Acute hemolytic. Usually there's interaction between antibody and antigen. They can have fever. They can have hypertension, tachycardia. They have back pain, chest pain, and jaundice. Allergic reaction is due to histamines being released from the mast cell. So they have urticaria, they have hives, pruritus. Treatment is just antihistamine. But if it's really getting worse, they develop bronchospasm, hypertension, tachycardia, respiratory distress, dyspnea. All of them is anaphylaxis. So this question is designed to give you good content in a very short time, giving you all the reaction that occur with blood transfusion, except to that I've not done. Take care of yourself.